Welcome to hepatitis B and C talk on public interest. Well, what is hepatitis B and C? Hepatitis B and C is a disease caused by virus infection. There are viruses like hepatitis A, B, C, D, E and G virus, which are mostly prevalent in the globe. Then how can you get hepatitis B and C? It transmitted through contact with infectious blood and body fluids. Body fluids like saliva, semen, and other fluids, TS, etc. And you can get hepatitis B and C even with the IV drug users. If you share needles, if you share razors, if you share toothbrushes, and other household sharing if you have. Then sex. If you have sex with infected partners, you will get hepatitis B and C infection. So why it is important, hepatitis B and C, to know? Because it causes your liver damage. So it may lead to chronic liver disease, cirrhosis, liver cancer, ultimately death. So who are the people at risk? People at risk are baby born to infected mothers, sex partners if one is infected, household contact as I have said, then healthcare worker, most importantly, they suffer from occupational exposures. So they should prevent by themselves wearing some gloves. So how do I know if I get hepatitis B and C virus? See, the symptoms, there may not have any symptoms at all, or if they may have symptoms with very severe disease. Initial symptoms may be flu-like. You may have loss of appetite, nausea, vomiting. You may get body aches, and ultimately in the later part of the disease, you may have jaundice, that is yellow coloration of the skin. Simple blood test is necessary to know what is hepatitis B. You can detect hepatitis B and C with a very simple blood test. Then precautions. What are the precautions one should take to not to get hepatitis B and C? So if you know how to transmit, as I have said, then you can prevent yourself. You do not have sex with unknown. Avoid sharing needles, toothbrushes, razors, etc. And those healthcare workers should wear latex gloves so they can prevent themselves. Can I get protected against hepatitis B and C? Yes, why not? For hepatitis B, we have vaccine, but for hepatitis C, there is no vaccine till today. So once you take hepatitis B vaccine, there will be body immunity, and it can prevent your getting infection from infected person. Is there cure of hepatitis B and C? Yes, of course. Hepatitis B is spontaneously cured in 90 to 95% patients, so you need not worry. For hepatitis C, of course, it just reverse. The 15% cases, they are acute and spontaneous cure is possible, but 85% cases approximately, it goes to chronicity. So therefore there will be further liver damage if untreated. And the treatment option, for hepatitis B virus, there are treatment options, injectable forms and oral forms. For hepatitis C virus, you can say 80% cases data shows that there are certain genotypes like genotype 2 and 3, 80% cases are cured or sustained virological response. That means what? The sustained virological response is, if you treat a patient for 6 months with the hepatitis genotype 2 and 3 and do a test, find negative, and then another 6 months if the case is negative for hepatitis B and C, then you can call it sustained virological response. That case may be cured case, or it may relapse in any time if you are unfortunate. But for hepatitis C, till today, that you can only suppress the virus, which will not damage your liver and not cause cirrhosis, not cause liver failure and death, etc. So one should get treatment for hepatitis B to suppress viral load in the body. About the treatment, hepatitis B and C, there may be acute infection and the chronic infection. In acute infection, it is very difficult to detect for hepatitis C cases. So accidentally we can detect. Most of the cases for hepatitis C, it goes to chronicity. 85% or 90% cases goes to chronicity. It causes chronic liver disease, liver damage, liver failure, and ultimately liver cancer. There are certain drugs for treatment of hepatitis B virus which suppresses the viral load in the body. It will not damage your liver if you suppress the viral load in the body. So one should get treatment for hepatitis B virus. But for hepatitis C virus, I have said 80% cases of genotype 2 and 3 cured, or you can say there will be sustained virological response. So which will not harm the patient, not cause chronic liver disease. There is no chance of hepatocellular carcinoma. So what advice should we give to the patient? We should advise patient not to take alcohol, because alcohol accelerates liver disease. It may cause cirrhosis. The both synergistic effect will damage your liver in a very early period. So one should not take alcohol, and then one should not take painkillers like paracetamol or other painkillers without discussing with your physicians. Should hepatitis B and C infected person be restricted from working in certain occupations or settings? No. We should not exclude it from work, going to school, going to play, child care, or other settings on the basis of hepatitis B and C virus infection. So there is no evidence hepatitis B and C transmission from food handlers, teachers, or other service providers in absence of blood-to-blood contact. Lastly, I want to tell you that you should not get panic once you are infected. There is treatment. If you follow the precautions, if you follow all norms, if you modify your lifestyles, so definitely there will be no harm in your body. Even otherwise also, most of the cases get cured spontaneously. So you need not worry for hepatitis B and C virus. But remember, you should test, because every 1 person out of 12 is having hepatitis B and C. So you should be very cautious. You should test your blood to detect hepatitis B and C to prevent further liver damage. Thank you.